Hi folks, Dr. Ed Beyer here. I'm making this video. I want to talk to you a little bit about underactive thyroid. There are so many people, especially females, out there suffering with fatigue, low energy, hair loss, digestive issues, weight gain even though they're hardly ever eating. All of this, it's no way to live, and many of you are not being diagnosed properly. There are multiple pieces to the thyroid dilemma. Traditional medicine just looks at one of them. We practice functional medicine in our clinic in Tinley Park, and we go over and we identify all the underlying causes. But I'm making this video, I want to share with you an actual case study, a patient by the name of Jody who was referred to me by her sister in Boston, and she heard about what we do in our clinic and that we get good results. Here's Jody's story. Okay, we're here with Jody, and Jody is just finishing up our program today. Jody, can you tell us what brought you to our clinic? How'd you find me? And what were your main symptoms when you first started?
Okay, sure. I was referred by my sister, who actually is in Boston, but she knew a doctor who knew Dr. Beyer, and I'd kind of been at my wit's end, not feeling well for many years. I'd been diagnosed with Hashimoto, so I knew I had that, but the medication wasn't solving a lot of my issues. Still very tired, fatigued, weight gain, a lot of stomach problems, and so I figured I would give this a try.
Okay.
And
how are you doing today? 6 months, about 6 months now,
about
right?
6 or 7 months later,
Right.
totally different. Really changed my life around.
That's great. And do you feel like you've learned in this program, like why, the underlying why?
Oh, definitely. And I think if you ask my husband, he'll say Dr. Beyer's the first doctor that ever explained things and looked at the cause of what was happening to me instead of just prescribing medication for the symptoms. So it really come away with a much better understanding of what's going on and why I was feeling the way I was feeling.
Okay, that's great. Thanks. Now, what we found on Jody, really the underlying causes, is that her thyroid was not working properly because her immune system was attacking it. That's called an autoimmune disease, and in the case of thyroid, it's called Hashimoto's hypothyroidism. Now, traditional medicine doesn't look at that. They don't really recognize that too much, or they can't really do much about it. All they're going to do is give her hormone replacement therapy. What we did from a functional medicine point of view is we identified the underlying causes why her immune system was making that mistake. And in Jody's case, she had an iron deficiency anemia. That in and of itself is going to cause fatigue because she wasn't getting enough oxygen. And iron deficiency anemia, she was getting that because she wasn't digesting her iron because she had poor gut function. And also iron deficiency anemia is a trigger to autoimmune problems. She also had a gut infection. She had a parasitic infection in her gut that we identified and we had to clear up. And some food sensitivities and multiple things that we found on her. And as you can see, she got her life back. Listen, folks, you don't have to suffer with all the symptoms of underactive thyroid. If you're going to your endocrinologist, you're going to your doctor, and you're not getting answers, and you're not feeling well, I'm going to tell you right now, I'm going to strongly recommend you click on the link on this video here and watch my full-length video on how we manage and support people with underactive thyroid. It may change your life. Hope to see you soon.